Let's talk about pain management. Most people have aches and pains sometimes. If you're healthy, chances are you don't have much pain unless you have a bad gait or you lie down on a pillow that's not comfortable, or you're working out and you did a little too much and you get aches and pains. That is easy to fix. But if you're diabetic, you're overweight, and you have problems with blood sugar levels, chances are you're going to have all kinds of aches and pains. I had a patient who came to me with so-called rheumatoid arthritis and was on 5 different medications, lost a job, couldn't do a thing, completely debilitated, could hardly move her fingers. It was so bad. She couldn't even put on her clothes. Her husband had to put her clothes on. So anyway, she came to me and I told her, chances are what you're eating and your lifestyle may be causing aches and pains. So how about we kind of eliminate certain things? So we started off with the diet. It will be changed from eating processed foods, eating a bunch of dairy, lots of carbohydrates. So we went into a more vegetarian kind of a program. Lots of vegetables, and for protein I told them it's okay to have 2 eggs in the morning. A good veggie omelet will be great for breakfast, much better than the typical pancakes and bacon or whatever. This high glucose rich breakfast is the wrong way to start the day, because if you do that, your sugars are going to spike, then they come down because your insulin now is triggered to bring the glucose levels down, and within an hour or two you're hungry again because the levels are coming down and you have no control. You just want to go get some more carbs. So the better way to do it is to have a more sensible kind of a breakfast. That's a good way to start the day. We changed the diet from all the stuff I talked about to a plant-based diet, avoiding all dairy, which means no milk, cheese, butter, all of that stuff. Not even yogurt, because I think yogurt is sometimes overrated, because a lot of the yogurt you get has a lot of carbohydrates in it and it's sweetened, so you don't want all that. So stick to a non-dairy, low carb or moderately high protein diet. Check your hormone levels. Usually when you're overweight and you have a big belly, chances are there's more room for your large bowel to expand and hold more stuff in. And especially if you're on a high fat diet, the body naturally has to take a little while to process all the fat, so it slows everything down. The alimentary tract is now working at 1/3 speed, kind of like a slow motion. So you start holding back a lot of waste that should be in the toilet. Now you're carrying it around, almost like a walking porta potty, so it's really disgusting when you think about it. So once you get the bowels working better by getting rid of the waste first, with therapeutic enemas, we do something called colon hydrotherapy. It's a very comfortable procedure. You come in, warm water goes up into the colon, dislodges all the fecal matter that is stuck to the walls of the colon, and it's gently sucked out. And you do this several times. First of all, they're empty. They're not being contaminated with high fat, high processed foods, so it starts working better. The speed gets back to normal, so instead of having a very slow gut, you now have a gut that works normal. The frequency of bowel movement should be about 2 a day, so whatever you eat today should be out of your body by 24 hours in general. So if you can't do that, you start accumulating stuff. It actually expands the colon walls, and we have something called a leaky gut, which is really just over distension of the colon walls, and the mucosal lining kind of opens up. Now you have direct entry of the waste material into your system, and that's what makes people sick. And if you're sick in the gut, chances are you're not making the vitamins that your body normally creates, or even the neurostimulators like serotonin and dopamine, which really is made in your gut, and that levels go down, and now you can be depressed or anxious and stuff like that, which can sometimes just relate to the kind of food you eat and the kind of lifestyle you have. This patient got better. Her weight was 30 pounds down. She was mobile. She could move her fingers, put her clothes on by herself, and she did not need any of those medications that she was on for the last 6 to 7 years when we got to see her. So I tell patients that's part of the detox situation that we talk about in California Wellness. So the way to get healthier is to change the diet, eliminate processed foods, dairy, stick to a plant-based diet, pump up your hormones to high normal, moderate exercise, and these are the ways to actually take care of all the aches and pains that you might have.